Hey guys, it's Dr. Paul Lynch with Arizona Pain. I'm here today with a patient that we've been treating for over 5 years. She had a partial knee replacement and still continues to hurt every day. As a matter of fact, her pain got worse after the surgery. Her knee looks mechanically okay, but she has this crazy nerve pain that just won't go away. We found that we were able to help her pain by doing what's called genicular nerve blocks and then genicular nerve radiofrequency ablation. This has been part of interventional pain management for the last 10 or 12 years now, and we've helped a lot of patients. But this particular patient, her pain just keeps coming back and keeps coming back. So today, we're going to place electrodes next to the genicular nerves above her knee, and we're going to stimulate and try to take away this chronic neuropathic pain.